I recently returned from the 2007 meeting of the American Society of Clinical Oncology, or ASCO. There were about 30,000 attendees at this 43rd annual meeting, presenting a total of 21,188 presentations, plenary lectures, clinical science symposia, oral and educational presentations, poster sessions, and about 10,000 publications that were listed in the proceedings but not actually presented in an oral form. ASCO is considered the most important event for the worldwide oncology community. Although it is called the American Society for Clinical Oncology, it is a very international meeting, and you are likely to hear German, Chinese, or Spanish being spoken in the corridors, as well as English. One cannot help but be impressed by the tremendous organizational effort it took to produce a meeting of this size and scope, as well as the phenomenal amount of time, effort, and money to produce these many papers and discussions. In the face of so much irrationalism in the world, not to mention madness, it is heartening to see science making such an effort to cure one of humanity's worst scourges. That said, however, let me give you my admittedly subjective impressions of the mood at ASCO. It seemed to me that the community was rather dispirited and discouraged by the lack of progress that we see today. This contrasted with the major announcements at previous meetings and the excited cheering of drugs like Gleevec and Herceptin. I kept waiting for the big announcement to come, but it just never happened. It was all very low-keyed. Even as I sit here at my desk, recovering from jet lag, I find it hard to write much or to speak that actually stirs the blood. It is sort of ironic that the top stories that were highlighted at ASCO this year concerned complementary and alternative treatments, including shark cartilage, flaxseed, and ginseng. The report on shark cartilage was entirely negative, while that on flaxseed and ginseng were rather positive, the first time I can remember that ASCO publicized the benefit of some natural methods at a major meeting. But it is my perception that the number of papers on innovative forms of treatment seems to be diminishing, or at least not increasing appreciably. Although the New York Times on June 3, 2007 described shark cartilage as a, quote, widely used alternative therapy for cancer, this characterization is dated. My perception, and that of other observers of the field, is that shark cartilage has largely been superseded as a cancer treatment by many other substances. In fact, I cannot remember the last time that a cancer patient told me that he or she was using it, or asked me for my opinion on it. William Lane's once notorious book on the topic, Sharks Don't Get Cancer, was published 15 years ago. It, and a follow-up book, has been out of print for many years, so the topic is mainly of historical interest. It was therefore not really important news, or news at all, that shark cartilage did not seem to help patients with lung cancer live longer. A 2005 clinical trial had in fact already shown that, quote, there was no difference in overall survival between patients receiving standard care plus a shark cartilage product versus standard care plus placebo, end quote. The reason for highlighting CAMP treatments was the acknowledgement by ASCO leaders that, quote, many of their patients are taking these supplements, widely available in health food stores, and asking them about them. So they told the Times, quote, well-designed clinical trials are needed to determine whether these approaches are helpful or harmful, end quote. Quote, one of the most common questions patients ask me is about these things they have snookered away in their purses and pocketbooks, said Dr. Bruce Chasen, a hematologist at Georgetown University, who moderated an ASCO news conference on the studies of the therapies. And I think his own bias is implicit in the use of the derogatory term snookered, but that's just my feeling. Dr. Charles Liu of the MD Anderson Cancer Center in Houston, the shark cartilage trial's lead investigator, said he thought there was reason to believe that cartilage might work. That was because it was an early contender in the field of anti-angiogenesis, a strategy for stopping or slowing the formation of new blood vessels. Shark cartilage contains factors that do slow the formation of blood vessels. The shark cartilage extract was given as a liquid that patients drank twice a day. This was not the first setback for the anti-angiogenesis hypothesis. But lung cancer patients who received Charcot lived a median of 14.4 months, while those who got placebo had a median survival of 15.6 months. In the flaxseed study, led by scientists at Duke University Medical Center, 161 men who were scheduled to have their prostate glands removed because of cancer, the tumors of the men who had taken flaxseed grew about 30 to 40% more slowly than those who did not. This presumably was a good thing. In the ginseng study of 282 patients with various kinds of cancer, it was found that the powdered root helped fight fatigue. About 1/4 of the patients who took 1,000 to 2,000 milligrams a day of a powdered extract of ginseng root reported that their fatigue had become moderately or much better. That contrasted with only 1/10 of those who took either a smaller amount or a placebo. Dr. Deborah L. Barton, the oncology professor at the Mayo Clinic, who was the lead investigator on the ginseng study, cautioned that many commercial ginseng supplements do not use the same Wisconsin ginseng that the study did. I find it a little unlikely that the Chinese, who have been growing ginseng for about 4,000 years, wouldn't know as well as the Wisconsinians how to grow ginseng. There was nothing particularly remarkable about either the ginseng or the flaxseed study. What made them unusual was that they were so prominently featured at ASCO. On the other hand, don't expect the posture of the average oncologist to change anytime soon regarding CAM treatments. I had the pleasure of spending some time at the booth of the Annie Appleseed Project, an organization that promotes the fair testing of diet and supplements in cancer. My observation was that most American oncologists simply ignored this alternative information as they made a beeline to the elaborate and expensive displays of the largest pharmaceutical companies, some of which were offering gifts to doctors in exchange for listening to lectures on their products or filling out questionnaires. Foreign oncologists, especially those from Asia, seemed more receptive to CAM and sometimes stopped by to chat. Overall, ASCO 2007 gave a good impression of the enormous amount of work being done in oncology by thousands of dedicated professionals. On the other hand, it was surprising that, while there were some incremental improvements for a number of cancers, there were no important breakthroughs that were announced. This undoubtedly had an effect on the overall mood of the conference, which, as I say, seemed rather low. I hope to have a more complete discussion of results from the 2007 ASCO meeting in Chicago, available at our CancerDecisions.com website in the next few weeks. For CancerDecisions.com and its podcast newsletter, this is Ralph Moss.